Awesome. Thanks so much, Hansel, for the introduction. Hansel is my co-director of the case competition that Glenn spoke about from the CHOP side. Thanks. So my name is Farouk Dako. I'm the director for the Botswana-UPenn partnership. I have all these different organizations up here because it is indeed a partnership between University of Pennsylvania, obviously CHOP, the Ministry of Health in Botswana, and University of Botswana. And we have been in Botswana since 2001. Initially, during the height of the HIV pandemic, we were invited by various stakeholders, including Merck Foundation, Gates Foundation, to really come and help out with the crisis in Botswana. At the time, there was no medical school. And so as you can imagine, we had to set up a whole office to be able to process grants, pay staff, hire people, and things of that nature. Over the years, as you can see, funding sources have evolved. We had a big PEPFAR support sometime from 2006 to 2016 that focused more on women's health, informatics, and we're able to expand beyond just the HIV care. And then we had a period of COVID-19. As you can imagine, things slowed down a bit as far as travel, and now we're looking to the future, right? And so I've been in Botswana for about 6 months at this point, understanding what the goals are in the country. And right now, they're focused on 3 things that I have up there. They're working on universal health coverage, health system strengthening, and digitizing of their healthcare system. And so we want to be strategic partners in these core areas. And I would like to tell you guys that business is booming in Botswana. Grants are actually flowing. More people are back visiting. Every other week we have a guest from Penn, CHOP, and from other institutions. And so things are really, really looking up. And so I just wanted to talk a bit about one vision, which is this idea of making BUP a center for excellence in various things. I'm a radiologist focused on AI and informatics. So understandably, this is something that I think we can start with, which is, what can we do beyond just, our traditional grants? How can we coalesce, as Glenn said, have all these efforts happening in Botswana coalesce into a strategy to be able to improve their informatics support there, but also, have it be a resource for our researchers at Penn, a place where you could extend your research to, a place where we could potentially train and develop a workforce that can serve us here as well, while creating jobs over there. And really, like I said, given their focus on health system strengthening, how do we start to measure our impact and strengthen their healthcare system? And so, I just have this diagram up here just showing BUP as a hub for bidirectional exchange of workforce, of ideas, as a hub where we attract other people in the region to come work there and help actually make their dreams come true. And so that's really it for me. Just a quick overview of what we've done and one big vision that we have moving forward. I hope I kept to time. Thank you very much.